Did you know that you actually can heal your body and your body is meant to heal? So this particular commenter said, a year ago, I had hip pain. I couldn't put on my socks. I was diagnosed with osteoarthritis, which is arthritis. I have been lifting, working out ever since, walking, and no pain. What this particular commenter is saying is when they changed their movement patterns and they started moving their body, they were able to heal because movement is medicine. Movement is key. Now, our brains want to believe everything we say. Usually when we talk about arthritis and osteoarthritis, we say phrases like wear and tear. It is what it is. We're bone on bone. But if you think about it, all our joints are bone on bone. They are held together by tendons of the muscles and ligaments that connect bone to bone. All our joints are bone on bone. When somebody gets an x-ray and there are changes, but there are other things that we can do to help our bodies heal. So instead of saying wear and tear, it is what it is, what if we said movement is medicine? What if we said we can bend our knees and mend? We can bend and mend. Now, there's a physio who is brilliant. He's an innovator, and his name is David Butler. I want to show you a video of him because he's phenomenal. And he and his group are talking about what we can do to change our verbiage and how we treat arthritis. Because just because you have arthritis doesn't mean that's it. That's as good as it gets. No, we can mobilize our joints. We can change our movement patterns. We can strengthen our muscles. We can change fascia. We can change our habits. We can decrease our inflammation and therefore change the pain and how we feel and move.
Hi there, Maria. When did this knee problem start?
About 3 years ago. It's been 3 long years. It started during a walk on Kangaroo Island after a little bit of twist.
And what sort of things worry you now?
Squatting. I've given up tennis and long walks. I just don't know what to do, to exercise or rest.
Yeah. What sort of things have you been told?
Well, I've had some scans. I was told I have a bit of arthritis and some wear and tear and that I'll eventually need a new knee. My neighbour, he's got it too. He reckons his is bone on bone, made worse because he's got knobbly knees. I guess I'm bone on bone then too.
Okay. Well, Maria, I've had a good look at your knee and how you walk and move, and it's a bit swollen, yeah, it's a bit tender, and you are walking a little bit like a damaged duck. But I want to say it's structurally okay, and I can help you with this. You'll be doing most of the work though. You don't need a knee replacement, and indeed, in the future, if you do, let's get the knee as healthy as we can now. Mm-hmm. So hold your knee, just feel down on the side there, find the knee line, the joint line, just bend it a little bit, and just marvel at the movement in there. Because inside, on the bone surfaces, are tough, long-living cartilages. And they really respond, and they need some compression for their health as you walk. And I'd like to tell you a little bit more about this.
Yeah, but what about the bone on bone?
Okay, bone on bone. It's a scary term, isn't it? But in fact, all of our joints are bone on bone, and we all have a bit of wear, and particularly in the knee. And although the cartilage may be thinner, there's always a bit of cartilage there, and there'll be a gap. You might remember in your x-ray there was a gap. So for now, I'm going to get you to swap the bone-on-bone thinking for, yeah, there's a bit of wear, but I can repair.
But they told me it's wear and tear in there.
Okay. I'm going to get you to change the wear and tear thinking too. First of all, it's a rhyme. And rhymes, we remember. 40 days has September.
April, June and November.
That's right. So, yeah, a bit of wear, but there's nothing torn. And the rhyme is actually wrong for your knees. An antique dealer would say, Maria, that with that bit of wear, it's the kisses of time, and your knees are really valuable. Let's replace wear and tear with bend and mend.
So bend and mend is what we're doing. Movement is medicine. You're not a lost cause.